I'm no doctor, but apparently you need some D. Vitamin D. Hello, folks. Scientific Health with a K here. Today, we're going to talk about vitamin D deficiency. Let's get started. Vitamin D is one of the fat soluble vitamins. This means it is absorbed by the body with the help of fatty foods. Vitamin D is responsible for absorbing calcium. Thus, its deficiency is a common condition that affects calcium absorption. Now let us talk about the reasons behind vitamin D deficiency. Insufficient exposure to sunlight. Vegetarians who don't eat animal products containing vitamin D. Kidney patients or old people. Gastrointestinal diseases such as malabsorption and Crohn's disease. And none other than obesity. Now, let us move to the symptoms of vitamin D deficiency. Rickets for young children. Body weakness. Weak bones in adults, which make them more prone to fracture, especially the pelvic fracture. Weak immune system, increasing the body's chance of getting respiratory infections. Hair loss and slow wound healing. Increased risk of cardiovascular diseases as well as cognitive impairment in the elderly. The recommended daily amount of vitamin D is 400 international units for children up to 12 months, 600 IU for people aging between 1 and 70 years old, and 800 IU for people aging more than 70 years old. If you have these symptoms, you might take a look at the treatment. But first, please check with your doctor. There are natural sources of vitamin D, such as exposure to sunlight. The most important source of vitamin D is the sun. Try to get enough sunlight exposure between 10 to 15 minutes, 20 minutes and over if you have a dark skin. You can also take vitamin D from food. We can find vitamin D in seafood such as sardines and tuna, and also in cod liver oil, which is rich in vitamin D. Yolk, mushrooms, cow's milk fortified with vitamin D. You can also take vitamin D supplements, but please check with your doctor first. It's also important to note that people who got coronavirus had vitamin D deficiency simply because they didn't get enough sunlight exposure or they had poor diet. The bottom line is, if you want to stay away from vitamin D deficiency, you might consider having a good diet rich in vitamin D, supplementation, and checking out the other videos. Please take some time to check the studies in the description box.